Hi, it's This Week in Psychiatric Nursing from Psych.y. I'm Cassie Powers. I'm a psychiatric nurse practitioner in Portland, Maine. Each week, I bring you a brief summary of news, policy updates, and research findings that affect the work we do in behavioral health nursing. Let's get into this week's report. Quick reminder, this video is for educational purposes only. It's not medical advice. Today is Friday, July 31st, 2026. Here's what we're covering. First, I'd like to take a look specifically at some nursing research about youth help-seeking attitudes when it comes to seeking help for mental health. And then I'd like to look at a study on ADHD treatment modalities in pregnancy and comparing risk profiles. Then I'd like to look at a report on the role of infection in neuropsychiatric conditions, specifically hospitalizations for infections. And finally, let's look at a cohort study on social media use and ADHD in youth. Let's start with the nursing research spotlight. So this comes out of the American Psychiatric Nurses Association original research regarding help-seeking behaviors. So what are the factors that influence high school students' attitudes towards psychological help? And what does this mean for behavioral health nurses? So this knowledge can influence our attunement to youth willingness to seek mental health care. This is an article that comes out of the Journal of the American Psychiatric Nurses Association. What are the factors that influence adolescent willingness to seek psychological help? So this was a cross-sectional study. It was conducted in Taiwanese youth and their caregivers, and the goal was to examine how depression literacy, stigma, depressive symptoms, and caregivers' attitudes toward professional psychological help influence adolescents' help-seeking attitudes. What they found was that help-seeking attitudes are shaped by both their own psychological experiences and their caregivers' perspective, so both things matter. Targeted interventions should prioritize stigma reduction, symptom recognition and management, and caregiver engagement. So what are the limitations with this study? Well, it was conducted in Taiwan, so we don't know if these findings can be extrapolated to other countries. Moving on to an analysis which takes a look at the risk profiles between non-stimulant and stimulant therapies for ADHD in pregnancy. And this comes from the journal Psychiatric Research and Clinical Practice. The study is the comparative risks of pregnancy complications in women prescribed psychostimulants or atomoxetine during pregnancy following pre-pregnancy stimulant use. And this was an electronic health record review analysis. So the study came out of a rising trend of increasing numbers of women who are prescribed stimulants and atomoxetine during pregnancy. So despite inconclusive evidence for their safety in pregnancy, we are seeing this rising trend with increasing willingness of prescribers to go ahead and treat ADHD during pregnancy. We know that symptoms of ADHD can cause major functional impairments for those who have the diagnosis. The findings were that atomoxetine, women who were treated with atomoxetine during pregnancy had greater risks of fetal growth and labor delivery complications than women prescribed stimulants. That's not all though. So what they found with stimulants is that women prescribed stimulants during pregnancy were associated with higher odds of prenatal, maternal, placental, and birth-related complications compared with those receiving atomoxetine. So both treatments had risks and they were somewhat different. The limitations here are that these findings can't prove causation, right? We can just show the associations between the two things. So, and what other factors might have influenced outcomes among the electronic health record data. So the implications for psych nurses here are that patients need psychoeducation about the risks and benefits of going ahead with treatment for ADHD during their pregnancy. And we just don't have a lot of data yet about the safety profiles of these different treatments. So patients may need a customized approach to treating their ADHD during the pregnancy period. Let's move on to a report about the role of infection in neuropsychiatric conditions. This came out of a report in Journal of American Medical Association Psychiatry, and this was regarding hospitalizations for infection and their link to later neuropsychiatric disorders. So this isn't just routine infections that people may be treated for on an outpatient basis. And again, this was an electronic health record review. More than 100 million patient records were used to create this report. So an astonishing number of data points here. And it was used to examine the risks of 14 psychiatric and neurologic disorders following infections across 10 body systems. The findings were that hospitalization for infection across a range of these body systems, especially older adults, are at increased risk of psychiatric and neurologic diagnoses in the following 2 years. So it looks to be that the 2 years after hospitalization are an especially vulnerable time, especially for older adults. So the greatest absolute risk was for cognitive deficits, a 19.1% risk following a cardiac infection, compared to 6.7% for those hospitalized with non-infection. Clearly increased risk for cognitive deficits. The implications for behavioral health nurses is that we really need to keep an eye on our patients after hospitalization for infections. The limitations here is that this did not include COVID. This was conducted with records from prior to the COVID pandemic. And it was limited to hospitalized patients. So we can't assume that this applies to, again, outpatient settings. Let's move on to looking again at ADHD and social media. And this was regarding problematic social media use and attention deficit hyperactivity disorder symptoms in adolescents. Shared processes in ADHD and problematic social media use include attentional control, impulsivity, and reward sensitivity. So we know that in this country, in the US, age 3 to 17, 11.4% of those kids are going to have received an ADHD diagnosis at some point. The findings of the study showed that these problematic behaviors were associated with higher parent-reported ADHD symptoms the following year during mid-adolescence. So the associations were most significant among males, but not for females. So what this study is saying is when there's a period of problematic social media use in the next year, symptom reporting goes up. That's by caregivers, not necessarily by the patients themselves, the kids. So that's one of the limitations of the studies, is that these are parent-reported symptoms, and that may differ from the youth self-report. Parent report is usually more closely aligned with clinician assessments. So psychiatric nurses may want to take note of their male adolescent patients, in particular those who have ADHD. These folks may benefit from psychoeducation regarding the risks of problematic social media use and interventions related to digital health. Social context that teens live in does affect their willingness to ask for psychological help. And treatment for ADHD in pregnancy is understudied and it is not risk-free. And post-hospitalization for infection is a high-risk period for neuropsychiatric complications, especially among older adults. And it appears there is a bidirectional relationship between problematic social media use and ADHD in young people. I'd love to know, how will any of this information affect your practice, if at all? Please feel free to share in the comments. That's it for this week in Psychiatric Nursing from PsychWise. I really appreciate you being here. That's it for this week in Psychiatric Nursing from PsychWise. Please be sure to follow along for weekly updates, share this with a nurse in your life, and please feel free to leave comments and questions below, especially if there's a topic you'd like me to tackle for next time. Thanks for being here.